Hello, today I'll discuss on habit disorders. These are behaviors in children that is often carried out unconsciously and can interfere with child's development or social functioning. These are not physically harmful in the beginning, but if it persists for a longer time or if it worsens with over time, then it may become problematic. So today I will discuss some common habit disorders which is noticed in children. To define, habit disorders are persistent, repetitive and non-functional behaviors that are typically learned and becomes automatic. These are benign and self-limiting condition, so not much to worry. And these occur when the child is trying to cope with the anxiety, boredom, stress or emotional tension they are facing in their life. These are the common habit disorders which is noticed in the children, and in many of us as a child we may have faced all these, or we may have had these habits when we were child. So number one, many children they have thumb or finger sucking, very commonly seen. Nail biting is known as onychophagia. Many of the school going children and sometimes even till college age they do this habit. So the nail biting, it is also very common. Hair pulling known as trichotillomania. Another habit is nose picking. Another is head bagging or head rolling. And number 6, teeth grinding, bruxism, usually seen at the night time, and tics. So these are some common habit disorders. We'll shortly see what these are. Risk factors for habit disorders can be emotional stress or anxiety, family environment if it is not a very good environment, and then lack of attention or stimulation. Developmental disorders, autism, ADHD, sometimes it occurs with some other neurobehavioral disorders, and then with insecurity or trauma or any shock the child faces in the life. Example, death of very close person. So this type of trauma, if the child is having the emotional traumas, then there is a high risk the child may develop habit disorders. Let's start with thumb or finger sucking and nail biting. So these are common at age 1 to 4 years. If it is persisting beyond more than 6 years, then this condition is associated with sequelae like dental problems, that is malalignment of the teeth, and altered facial bone growth can occur. With the nail biting, they may have nail infections known as paronychia, and sometimes even digital deformity can occur. And then with the nail biting, infestations with the parasite is very commonly seen. So for these conditions, treatment is always not to criticize excessively. Try to ignore what the child is doing, and sometimes you may reward the child if the child is trying to change the habit, and then sometimes you can even splint the fingers to take this habit away from the child. Another is hair pulling known as trichotillomania. So here the child is repeatedly pulling out hair from scalp, eyebrows or eyelashes. So many times you see loss of eyebrows, and there are many patchy hair loss in the scalp, and which is very noticeable, and this is again often associated with the emotional disturbances. Nose picking, some children they have a habit of nose picking, very commonly seen also, and many times they land up with nasal bleeding, epistaxis in the OPD, and the reason, if you find out, it is nose picking. And this nose picking can sometimes be a social embarrassment condition also. Now come to repetitive behaviors. Repetitive pattern of movements are seen in this condition. So here the child shows different repetitive patterns like head banging, rocking of the body, and these movements are usually normal at age 6 months till 2 years. So beyond 2 years, commonly in the toddlers, these habits are seen as habit disorder. So may be seen at bedtime also, and with age it resolves. This is of two types. One is when the child is tired and bored, so this is known as low arousal state, they do these habits. Another is when they are angry and frustrated, that is also known as high arousal state, so this time also they show these behaviors. Again, treatment will be reassurance that it is a benign and self limiting condition. Also always try to ignore these conditions. Come to bruxism, that is teeth grinding. This is involuntary habitual grinding of teeth. So if this usually occurs during the night sleep time, so during sleep if it occurs, it is known as nocturnal bruxism, and if it is occurring during wakefulness, this is known as awake bruxism. Nocturnal bruxism is more commonly seen, and it also produces high pitched audible sound when they are grinding the teeth, and it is associated with the daytime anxiety. They do this to release the daytime anxiety. Now, problems with bruxism. There can be different problems with the bruxism. Number one, dental malocclusion can occur with jaw pain. Number two, tooth fractures and hypersensitivity of the teeth. Number three, inflammation of periodontal ligament of the teeth. Number four, hypertrophy of the muscles of mastication. Number five, tenderness and clicking of the temporomandibular joint. Number six, headache, mainly the temples. Temporal headache is very common because of this repeated continuous grinding of the teeth. So treatment, many times they use night guard and then try to relieve the stress, the daytime stress, and then it can improve. Now another habit very commonly seen is tics. This is sudden repetitive movements or sounds a child performs involuntarily. This is self-limiting and is temporary, but sometimes it persists for a longer time, then this becomes complex. So different types of tics can be motor tics. Here it involves movements like blinking of the eyes, grimacing, shoulder shrugging, head jerking. So these different type of movements are seen in motor tics. Another is vocal tics, also known as phonic tics. Here it involves the sounds like clearing of the throat, sniffing, grunting, humming. So this is known as vocal tic. Another is simple tic. This is tics which is short, quick movements are seen, or sounds are also heard, that is very short. Another is complex tics. Here the movement or sound is more coordinated. So more coordinated pattern of movements or sounds are heard. So example, here the child is trying to jump and touch things. Another is repeatedly saying the certain words. So this is a example of complex tics. Number 5, chronic tic disorder. Here if the tic is lasting for more than 1 year, this is known as chronic tic disorder. If it is lasting less than 1 year, this is known as simple tics. So here either motor or vocal tic is seen, both are not seen. Either movement tic occurs for more than 1 year or vocal tic occurs for more than 1 year. And number 6, this is a severe form of tic known as Tourette syndrome. So here it is associated with a neurological disorder. So this is also tic also comes under the classification of neurodevelopmental disorder. So here both motor and vocal tics is persisting for more than 1 year. So both are occurring, movement and vocal tics both are occurring. So here the child can just walk and suddenly sit in a squatting position and then say some word which may usually be bad words also. So both motor and vocal component is seen, and it is seen in a very complex form. So this is known as Tourette syndrome. Now come to the clinical approach, how you approach to habit disorders. First, take a good history. In the history you have to focus on age at onset and how quickly it is happening. and frequency, duration and pattern of the tic or other habits, and emotional triggers. You have to see the aggravating factors. Usually emotional factors are there, so those factors or any factors which is leading to anxiety to the child, so that you have to try to find out in the history. And then associated behavioral or developmental problems like ADHD, so other behavioral problems if the child has, then the habit disorders may be associated with that sometimes. So you try to find out those also in the history. Then do the physical examination. Here you have to assess physical damage to different parts, like nail biting, you check the nail beds, then teeth in bruxism, and then scalp in the hair pulling, trichotillomania. So these things you can see, and try to see the underlying neurological conditions, and try to assess the psychosocial assessment of the child's environment. Number one, in the home environment, how the child is, the house environment is. Another is try to check the school performance of the child and see how the child is the child's behavior in the school environment, and then check the parent to child interaction. Now come to management. In the management, general management is mainly counseling of the parents, reassurance to the parents that all these habits are benign and self-limiting, and with age it is going to disappear. And you have to tell the parents to avoid scolding the child and giving punishment for those habits. Just try to ignore them. Another is avoid excessive attention to the child, and then be patient and calm, and encourage positive reinforcement to the child. So many times positive reinforcement corrects many of the habits. Now come to management, that is the behavioral intervention, which is very important and also helpful. So here number one is habit reversal training you try to give. So here the teachers, you have to teach the child to become more aware of their habit and try to replace them with a healthier habit or some other behaviors. Example, just try to make them aware and then train them to notice the early signs so that they can change the habit. Another is distraction techniques you can use. So here some other competitive response training is given. So here you try to replace the habit, like for example, if the child is having nail biting, then when the child has a urge to bite the nail, then they can just clench the fists. And if the child is having the eye blinking habit, then the child can just close the eyes gently and then keep it closed or hold the eye closed for around 10 seconds or maybe 15 seconds. Gradually child can increase that so that this habit disappears and it is replaced with some other healthier habit. So this way distraction technique and habit reversal training can be done. And stress management can be done with some relaxation techniques like breathing exercises they can do, and then they can just divert their mind to some other things. And then positive reinforcement charts can be used to change these behavioral habits. Medications are very rarely needed. Sometimes it may be needed in severe tics, anxiety disorders or trichotillomania, or if it is associated with some other neurodevelopmental disorders, then you can use some medications. Otherwise medicine has very less role. Now come to prognosis. Most childhood habits are self-limiting. Persistence in later childhood may indicate some underlying psychological distress. So in this condition scenario, you need some psychiatric consultation. Okay, thank you. So today I complete the neurodevelopmental disorder chapter. So next class I'll start with some other new topics. Thank you. And if you find my lecture helpful, please remember to subscribe share and like. Thank you.